Good morning all, this is Kavipriya, lecturer from the Department of Cardiac Technology. Now the case presentation is about myocardial infarction. The topic is about ST wave changes abnormalities. Here the patient is suffering from mild breathlessness for 1 day. It is extreme pain in the chest region for 1 day. And giddiness also. The patient is about male. His age is about 54 years old and he is suffering from breathlessness and giddiness also. So here the present illness is about patient was apparently well before a day, and now he is suffering from shoulder pain, and the patient also having episode of breathlessness. He was immediately brought into the medical emergency department of hospital. The ECG was taken. The patient was diagnosed with the ST segment elevation of myocardial infarction. Here the ST segment abnormalities means a ECG during myocardial infarction. It is a signal heart muscle damage with the common patterns include ST elevation or ST depression, the T-wave inversion and hyperacute T-wave. Here this is ST segment elevation, normal ST segment. Second one is ST segment elevation, and the third one is NSTEMI. The fourth one is NSTEMI with the ST T-wave inversion. So the ST T-wave are which is corresponded to the evolving cellular electrical changes in myocardium, which is early MI diagnosis, localization of infractions, estimating infraction age and severity, and guiding reperfusion therapy for the myocardium. Here the one is ST elevation, the another one is ST depression. The physiology is about normal repolarization, that is ST segment isoelectric line baseline which is normal and T wave upright in most leads if it is reflect phase 3 of action potential, which is a potassium efflux in cellular. Here in MI, the ischemia causes ATP depletions, which is leading to the shortened action potential duration in the endocardium and also prolonged the subepicardium, myocardium and transmural, which is in transmural there is an ST elevation noted. Injury current flow from the ischemia to the normal tissue. Here the images for A is normal and B is ST elevation. Physiology and pathophysiology are, one is hyperacute phase, which means a tall peaked T waves, which is a sign of occlusion. The first one is tall peaked T waves and ST segment on baseline. T wave is uprighted, there is also no Q wave. Second one is acute phase, which is acute ST segment elevation in leads facing infraction and reciprocal depressions. See here ST segment get elevated. Evolving phase, the ST segment is elevated and the concave down. T wave may be in upright and inverted, and in evolving phase T wave inversion as infraction progress and Q wave may develop for necrosis, which indicating cell death happened. Chronic phase, it is persistent for STT changes or aneurysmal pattern also may included. There is no old chronic phase in here. Old MI ST segment has returned to the baseline and also T wave is again uprighted and Q wave is persisting, presence of Q wave. These are the type of ST segment abnormalities in NI. Criteria, it is about 1 mm, greater than 1 mm in limb leads, and precordial leads also it is greater than 1 to 2 mm. And patient age is very important, gender and age is very important. And now the patent is about convex in STEMI, which is indicating transmural injury, and if it is anterior, localization is about lead V1, V4 and V1 to V4. If it is inferior, lead 2, lead 3 AVF. If it is lateral, lead 1 AVL, V5 to V6, and if it is posterior, V7 to V9. The evolution is about peak in hours or resolve over days or week unless it is persistent to the aneurysm. Here the physical examination also be done for the patient whose general appearance is